Okay, it's great to have you with us this glorious sunny afternoon here in Auckland City. This is the second of the Shaping the Future webinar series, Shaping the Future through Health Sciences and Science. We are going to introduce our panellists shortly and spend about an hour with you chatting about our roles in this space here at the University of Auckland. So before we do that, it would be wonderful just to give you a bit of an overview of the University of Auckland here in Auckland City. Of course, we're launching into our summer here in Auckland, and we're looking forward to an open, sunshiny summer here in New Zealand with Auckland at level 1 in the COVID responses. So everything is open here. We're out and about. We've had a fantastic rugby game over the weekend with the All Blacks playing Australia. Of course, we won. We're very excited about that. And we're looking forward to seeing you here in New Zealand when it's safe to come. The University of Auckland is New Zealand's largest university with 42,000 students and about 5,000 staff. We're the top ranked university here in New Zealand, and we normally welcome over 8,000 international students from over 120 countries to us. We are ranked as the most innovative university in New Zealand and also have the best ranking for graduate employability, and that's really, really important to us. You can see that we're located right in the heart of downtown Auckland City, a city surrounded by harbours here in Auckland. We have 8 faculties and offer over 200 programs from undergraduate level all the way up to doctoral space. I've listed the faculties here, and you can see on the slide some key programs that are important to us and key subject areas. We're not going to talk too much about programs during this afternoon, but on this slide you can see the link to our study options pages where you can find everything you need to know about our programs that we offer, including opportunities for scholarship, including entry requirements, program duration, and subjects available within our 8 faculties. Here at the University of Auckland, as I've said, we've got a really diverse range of programs, but if you're thinking about what we do not offer, we don't have dentistry here in the University of Auckland, and nor do we have veterinary science, but we do cover pretty much everything else. So great to have you with us. We're going to talk about our partner universities now, over 180 partners in 45 countries, and the University of Auckland is a member of 3 global networks for universities. The APRU, which is obviously, as its name describes, the Asia Pacific Rim Universities Network, Universitas 21, and the Worldwide Universities Network, which is a research-focused network. We have links into over 100 countries, about 180 countries, as you can see here, 180 partners, as you can see here, in 45 countries, and our students are used to being connected internationally. One of the most important things that we celebrate here at the University of Auckland is our impact rankings. So we're the #1 university in the world in the Times Higher Global Impact Rankings. And we're going to spend a bit of time in this afternoon session talking about the SDGs, the Sustainable Development Goals, and our rankings there and how we contribute to those rankings. And so stay with us for this session. We have with us Professor Chris Bullen, who is a Professor of Public Health and the Director of the National Institute of Health Innovation here at the University of Auckland. Professor Thomas Lumley, who's in the Department of Statistics at the Faculty of Science. Associate Professor Jude McCall, who's an Associate Professor in Global Health and works in the Centre for Global Health at the Faculty of Medical and Health Sciences. And Dr. Nikki Moreland, who's a Principal Investigator at the Maurice Wilkins Centre and works within the Faculty of Medical and Health Sciences. I'm the moderator for this afternoon session. My name's Karen Dorian, and I'm the Senior International Manager for the Faculty of Medical and Health Sciences here at the University of Auckland. We are delighted to have with us Jin Song Chen. Jin Song is known as Jimmy to us here at the university. Jimmy is an alumni of the Master of Public Health and the Bachelor of Health Science here at the University of Auckland, and is just completing his PhD with Professor Chris Bullen. Jimmy's been awarded a number of scholarships and awards, and has success in digital health and functional game development. He's based here in the University of Auckland. Okay, so on to our first question, which I'm going to ask our academics to respond to. So I'm going to suggest that Jude answers this question that you see on your screen. Jude, the University of Auckland has ranked #1 in the Global Times Higher Education Impact Rankings for overall sustainable impact 2 years in a row, in 2019 and in 2020. Jude, can you tell us what sustainability means to you, and why do you think it's important to question traditional thinking about sustainability?
Thanks, Karen. I really like this question, and I was delighted to see it presented, actually, because I think these are, I think it really challenges us not to think about what we've done well in the past and sort of to ride on that, but also think about what our vision is collectively as an institution, and how we think about how we do sustainability, so to speak, in the future. So one of the things that comes to mind is when I think about traditional thinking about sustainability and what that word means, it conjures up ideas about environments, ecosystems, ecology, and things they want to covet and conserve. And I think that's still absolutely important, particularly in the context of environmental degradation and climate change. But I think we need to think more holistically in the future around sustainability. And what I mean by that is thinking about whole of systems and how we respond at a systems level to some of the big global challenges. I think we need to think about equity and how we can ensure and sustain equitable access to those precious resources that we rely upon. And I think in terms of sustainability, we need to think about some of the practicalities about making smart decisions, ensuring that they can be implemented and that they can be sustained. So sustainability in terms of sustaining and investing longer term in initiatives that can really have benefit, particularly for the most vulnerable, but for all. And that's in terms, and when we think about that, how do we respond as a university? How do we build capacity to ensure sustainable systems to support life in the future?
It's a fantastic answer to kick us off, Jude. Thanks so much. Thomas, would you like to contribute as well to this question?
Yes. So the part of the point, as Jude said, about sustainability is that it's not enough to have good sort of ideal practices. You need things that you can actually do and that you can keep doing and that people all over the world can keep doing. And one of the sort of things behind this that's important, particularly in a university, is taking advantage of knowledge and skills and abilities of people inside the university and outside the university. You don't want to waste any sort of human abilities, human resources. So equity, not just in the sense of providing things, making systems that provide things for everyone, but making systems that take advantage of everybody's skills and abilities.
Great. And Nikki, do you have something to comment on here?
Sure. I mean, really, I think just echoing and extending the previous comments, thinking about having sustainable solutions to health that are really supported by underlying technology and infrastructure. That means that when there is a new health challenge that comes along, all of that infrastructure and technology and expertise is in place to pivot to what a new challenge would be. And I think that's where the universities play a key role in the future.
Fantastic. Thanks very much. So, Thomas, I'm going to ask you to answer this question first. Considering your discipline, what do you think are some of the most important global challenges to address in the next 5 to 25 years?
Well, from the point of view of statistics, I mean, one of the key challenges, as we've seen this year, is modeling and understanding infectious disease, so that 100 years ago, everyone knew that this was one of the big challenges, but we've sort of forgotten about it a bit over past decades, and it's come back again. So that's a really important area, and that's an area where the University of Auckland has been playing an important role in the New Zealand responses to COVID, for example, and with test strategies being informed by mathematics and statistics, as well as by other relevant disciplines, and University of Auckland researchers being involved. But so that's a sort of modelling statistical area that's a big challenge.
Fantastic. And Jude, with your global health background, what do you think about this question?
I think some of the big challenges, I mean, certainly from the global health perspective, I'd certainly support what Thomas was saying, but I think some of the really big challenges, but some of the ways that we need to respond and draw upon the value and the kind of platform that a university like ours offers is our connections and ability to cooperate. And I think that's absolutely essential. And we've seen the importance of that in the COVID-19 response, the importance of global cooperation, the sharing of data, the sharing of developments in the vaccine front, etc. So I think this concept that's often seen as being quite sort of remote of collective action actually is something that universities really do well. And I think where we're positioned here in the South Pacific, it's of our interest, it's our viability. We have to connect globally, and we make it our business to do that. We're well known for our traveling, but when we're not traveling, we have established networks globally, and we really work with them, and they are looked after very well by colleagues here, because they matter. They matter here in New Zealand in terms of how we translate the work here, but they matter in terms of how we can share that knowledge globally. So I certainly think cooperation, collective action, and really good leadership are the things that I think are really important challenges, but real opportunities that I think we can take forward when we're based here at Auckland University.
Fantastic. And Chris, I'd like to bring you in now with your health innovation background. Would you like to respond to this question as well?
Yes, sure. So I think I totally agree with all that's been said by my colleagues around some of these challenges. Obviously, there's the huge issue of climate change, and we've got not only infectious diseases such as COVID-19 to battle with, but we've got the big growing burden of non-communicable diseases. And in fact, there's there's an interface between those two things, both for example, COVID, it's not just the infection, but it's the response to the infection and the impact that's having on people's equitable access to health services, and how that's playing out in their management of diabetes or heart disease prevention and treatment and so forth. So I think there are all of this from a solutions perspective definitely needs partnerships, collaborations, cooperation, and innovation. And we've already shown that as a human race, we can innovate very quickly when there's a disruption, and we can put in place systems or step them up very quickly. The way we're working here on Zoom is now second nature to us, but just a few months ago, for many people, it was a very new thing. And so we're able to reach out, communicate with each other around the globe, and have these kind of discussions and work on collaborative solutions. And I think that's the way forward, is working with the infrastructure that we have, expanding it to reach the people in the farthest regions so they have access to knowledge, information for action, and then cooperating to tackle these huge challenges that we face as a human race on our planet.
Fantastic. And Nikki, I don't want to miss you out on this question. Would you like to just add a couple of comments as well?
Yeah, I think I could just add a quick comment, and that's just picking up on the end of what Chris said around working together in collaboration. I think what's really important in our response is our ability as well to work cross-disciplinary. So bringing together people with all sorts of different expertise, you know, ranging from public health, biomedical science, really fundamental science and mathematics, and bringing, you know, a really broad area of expertise to work on a problem.
Fantastic. I think that kind of leads us really, really nicely into this next question, which is what is the role that universities should or can play in addressing these challenges? And Chris, you've talked about the NCDs and climate change. I wonder if you'd like to just expand on that a fraction.
Yes, so I think that Auckland University, like many other universities, sees that it has a responsibility to have impact beyond just teaching and writing research grants and winning awards and all those kind of things that universities have done. We see ourselves as very much part of our society and our society's response to these challenges and our global response. So we are interested as a university, we have particular areas of expertise that we can contribute alongside our partners in government, in non-governmental organisations, in the business world, in community organisations to work together. And our piece particularly is around discovery, discovering new ways of doing things, new ideas, bringing them to fruition through science, the application of a whole range from social science through to biomedical science, and innovation, bringing together, you know, through that cross-disciplinary, cross-pollination, coming up with something new and quite disruptive to address a real challenge. We're involved with education, bringing through people who have the skills and expertise to face the challenges for successive generations. But part of the role of our university is also to critique and comment on what's happening in our country, but also more broadly, in a constructive way, of course, and by you know, challenging and tossing around and debating ideas. And that's an important role that universities can have as an independent entity to do this and to get the debate and the discussion going. And that's certainly been the case over these last few months with COVID-19. There's been a real debate and challenge. We've seen that play out within our university and also more broadly around the globe with other centres of thinking and bringing out these ideas to face the global health challenge of COVID-19.
Fantastic. Thanks. Nikki, would you like to say a couple of words to this as well?
Yeah, sure. So I think what universities can do in addressing these challenges is, as Chris said, you know, disrupting a new technology, and a lot of that actually comes actually from quite basic fundamental research sometimes. And so I think that fundamental research has a place in universities, and sometimes, you know, we're not always sure where it may lead, but actually what we can see in COVID is a lot of the leading vaccines, that initial work was done, you know, by protein biochemists, by people in the lab, getting real expertise on these particular vaccine candidates and the technology and how they work. And so I think we can't underestimate the power of that fundamental basic biomedical research as well.
Fantastic. I'm going to pass on this question to you as well, Nikki. So the University of Auckland's ranked #1 in the Times Higher Impact rankings 2 years in a row now for the collective work we're doing in relation to the 17 SDGs. How can someone working in your area of science and in health look to make an impact themselves? So perhaps as an individual or as a group or department?
Yeah, sure. So I'll probably give a personal response to that question. So I work in the infection and immunity space, and my lab is really interested in understanding the immune response to infectious diseases. And so We have, for the last wee while, been looking at the immune response to COVID and using that to then look at ways to develop antibody tests for COVID. And we've been doing that locally with samples from local participants and local people, but in a very internationally connected way. And so while we're producing data that is locally relevant and informing decision-making here, it's also contributing to international knowledge and is quite relevant globally. And in a related example, my lab, when there's not a pandemic, normally work on group A strep, which causes rheumatic fever, and we're involved in global efforts to try and push forward vaccine development for group A strep. And so that's another example of an infectious disease that is highly relevant for us here in New Zealand and here in Auckland, but also has a lot of international or global reach in terms of the impact of the work that we're doing.
Thanks very much, Nikki. And Thomas, in the Department of Statistics, how can your area contribute?
So one way we can contribute is by making sort of modern statistical tools available to people everywhere in the world. The University of Auckland has been a leader in open source statistical software for 30 years. The statistical system R comes from here. And so that enables people, researchers anywhere in the world to use the sort of best modern statistical software, best modern statistical techniques in their work, no matter what sort of resources they have. So that's another area where the university has been making an impact.
Great, thank you. I'm going to pop on to the next question now, which is also in relation to our SDG rankings. So we ranked the University of Auckland ranked number 4 in SDG 3. Jude, this is a good health and wellbeing ranking. This is particularly pertinent to the conversation we're having. What are we doing at the University of Auckland that's notable in terms of good health and wellbeing that can make an impact both here and globally?
Yeah, look, I think we have a number of really good examples. And again, I probably will be slightly biased and draw upon those that I'm most familiar with in our faculty. But I think one that was really, one piece of work that was really significant in terms of contributing to our place in that ranking was the work around, I guess, fetal development work led by scientists at the Liggins Institute. So they've been really, I guess, in some ways breaking new ground in work around understanding early sort of fetal development factors and also looking at the life course, taking a life course approach to health and development more broadly. So I think that's been really influential and has had international influence. But I think in other areas that perhaps doesn't have quite the same visibility always necessarily is the work that we've been doing in the area of climate change and health. So we have colleagues who have been really leading the intergovernmental panel on climate change and health writing group. So this is really important. This is that science that's really looking at those impacts of climate on health and then communicating that and having that feed into hopefully global action. So that's been important. Also other areas of work that I think are really significant in terms of changing how we think and hopefully how we do things is our work around understanding obesity from a food systems and environments perspective rather than an individual behaviour perspective. So we've had colleagues who've led a Lancet commission on what's it called, malnutrition in all its forms. So that's thinking about all those factors that sort of feed into sort of food systems and the impact of those on population health. So they're really important. They have an impact everywhere in the world. And as obesity is one of the major contributors to non-communicable diseases, we really have to get a good understanding of that. And I think just finally, another area that I think has been really significant that our faculty, and there are many others I could add many more. But I think it's the work that actually Chris Bullen's group, if I can draw upon the work of National Institute of Health Innovation. So this is a group that is really trialing, prototyping new tools and innovations to really propel change in a way that would otherwise perhaps take a lot longer. So I think these are really important. And again, these adaptable, translatable tools, often freely available and evidence-based, so really based in good theory, as well as clinical trials to validate their impact. So I think that kind of covers a range of the strengths I think that our university is really adding value in this particular SDG area.
Yeah, thanks so much, Jude. You've mentioned the work that NIHI, or the National Institute of Health Innovation, is doing. So I think I'll pass on to Chris now to ask him to talk about his own work in this space around the SDG number 3, good health and wellbeing. Chris, can you talk about your own work in this space and why it's important in shaping the future?
Thanks, and thanks for the shout out there, Jude. We're all very much part of the team effort, and Jude and many others, and Jimmy, for example, have been very much involved along the journey. We've been working for about 15 years in digital health, looking at how to use simple digital tools to reach out to as many people as possible with very simple messages and tools to encourage them to change their behaviour in a range of areas. And we're looking at first off the rank was smoking. We've been doing that in New Zealand and globally using simple SMS messaging and testing that in the clinical trials format for efficacy and safety and impact. And then we've been able to test that with other partnerships in the Cook Islands and Samoa and elsewhere. We've looked at Jimmy's work, which he'll talk about, has huge potential in China and other countries in this area. So we think that the opportunities now to improve people's quality of life and length of life and reduce the risk of acquiring disease can often occur through giving people simple tools that are proven, that have been co-designed with them, built on good theoretical models and frameworks, tested through the rigorous process of clinical trials, and then translated into the real world of delivery, and then evaluated in that context. That's what gets me going. And it's a real privilege to work with people all around the globe in this area and to see the impacts of that happening in a range of areas, actually. So not just smoking, but also mental health, diet and nutrition, problem gambling, alcohol consumption, child well-being, and so on and so forth. Actually, many of these things are covered off in our complete list of the SDGs. When you look at the SDGs, this number 3 is obviously a health one, but in fact, all of them are health related in one way or the other.
Mm-hmm.
Just making that point.
Yeah, that's fantastic. Thank you, Chris. It's really exciting to hear about the work that you and your group and the wider university are doing in this space, because of course we're all connected to this. Nikki, with reference to the current global landscape, how does the teaching, training or research that you're doing in your area contribute to thought leadership needed for a better society? I know this is a big picture question, but it's an exciting one.
It is a big picture question. I mean, I think to start to answer this question, we can think about, in many ways, the COVID response that we've had in New Zealand, because this has been a very science-led response. So we've continually seen government leaders using science to drive the decisions that have been made in terms of public health and elimination strategies, through to understanding, the research around the virus itself, with our Prime Minister even talking about different genomes of viruses. And I think we've really actually seen the full force of science in many ways in New Zealand as part of our pandemic response, and that's been echoed globally as well. Our work in our lab has only really been possible because of our international connectedness and national collaboration. But the actual work in our lab, a lot of it has very much been underpinned by early career researchers. So a PhD student in our lab is the one who developed our first antibody test. A postdoc in our lab is the one who developed some of our viral neutralization capabilities. And so these are the leaders of tomorrow, and yet they are here underpinning our pandemic response today. And so, you know, they're getting trained right now, and we are relying on them, and they are really the ones who are driving a lot of this work forward.
Wow, that's really exciting, isn't it? Fantastic. Just to change tack a little, we've talked a little bit about health innovation. Chris, you work in health with a focus on health innovation. Why should we be focusing on these issues, and what role can health innovation play in the global community to shape a more sustainable future? So I'm going to ask you to respond to this first, Chris, perhaps briefly, and then ask Jimmy Jin Song Chen to respond after you, Chris.
Sure. So I think I've already covered a lot of this. I mean, I think the challenges that COVID-19 has sort of unmasked and revealed are many, but we do need to come up quickly with innovative solutions to problems such as COVID-19, and I'm sure it won't be the last of the global pandemics in many of our lifetimes. So we have to be ready and poised to identify new ways of doing things and solving these problems rapidly and collaboratively. And so I think it's not only sort of in our interests for survival, but it's the right thing to do. And we of course want to do it with the best information at our fingertips, and that's what places like the University of Auckland, of course, and our fellow university partners around the globe are able to help us with. So I'm going to pass on to Jimmy to describe his work, because he's really been at the coalface of doing some innovative work in China, and he can give you a much better description than I can of that work.
Thank you, Chris. And so just following the concept based on Chris' ideas and the National Institute for Health Innovations, we have just finished a trial back in China, but it is a digital trial, and it's based on the global widely used social network platforms WeChat. And we will be able to test our digital products to helping Chinese male smokers to quit smoking in China, but like while all the researchers are physically in New Zealand, and we can have a look at all the data back in China with our participants. So it's really one of the first in the world. And then on top of that, by facing COVID-19, we think that's a lot of health innovations will be used in the next decades. For example, we can use big data to analyze different cases all over the world. We can use machine learning to improve efficiencies of drug developments. We can use digital products to change people's health behavior. So all these areas are really important, and that we're going to change our landscape of health and healthcare.
That's fantastic, Jimmy. Your work has been recognised, obviously, with the awards that you've received in the time that you've been here at the University of Auckland. But you came to us after having worked or studied in Singapore, is that correct?
Yes, yes.
Yep, so you're a truly international individual here at the University of Auckland as an international student.
Yes, that's about 10 years ago, that's when I first came to New Zealand. And it has been like fantastic experience for me.
Fantastic, thanks. We're going to pop on to the next question now and ask Jude to respond to this. Jude, can you tell us more about the role global health plays in sustainability and the SDGs in today's increasingly interconnected world? We've heard a little bit about this from Chris already, and the work he's doing globally, and how we're also all interconnected, not only just within the university, but outside it. So Jude, over to you to talk about the role global health plays in sustainability and the SDGs.
Yeah, again, another really good question. And perhaps just to sort of go straight to the sort of heart of it for me, I mean, this morning, for example, I've just come off a Zoom meeting, as we all do. But this one is a collaboration that's just been initiated a couple of weeks ago to try and respond to the concerns that have been raised around the Pacific region, around mental health and well-being, and particularly mental health and access to services, not just in the time of COVID-19 where services have been diverted, but at other times as well. So it's just a really good example of how we work in global health. So we've engaged with partners both in the islands, in the Ministry of Health, and the University of Hawaii and University of Queensland. So you've got this very swiftly formed collaboration with people on the ground trying to deliver mental health services, recognising and articulating their needs, which is we need some data to measure the burden of mental health disorders in the region. We also need some training to continue to support our psychiatrists and other people working mental health in the region, but no one can leave. Can you help us? So it is around coming together in this environment where we are connected. We have those networks. We have built those relationships where people can say, we need some support in this area. And we can very quickly pull together a team of people who've got the experience and expertise to think about how we can contribute. And each of us brings something that's distinctive. So I think the focus in global health now has shifted, certainly 10 and perhaps further back. Global health was around high income or rich countries going into poorer or low income countries and fixing things, so to speak. It is not like that anymore. It's about what can we learn from other lower resource settings, how can we work together, and recognizing where actually we do add some value and where others bring in expertise. So I think that's where it's at in terms of sustaining partnerships, using those connections we've got and listening and responding to those needs and predicting what's coming up in the future as well, so to speak. So being prepared based on what we've learned about what we need to be resourced for in the future. Yeah.
Great, that's fantastic. Thanks so much, Jude. Now we have got a question from the audience, and we'll cover the questions from the audience at the end of this session. So if you have any other questions you'd like to ask of our panelists, please type them in the Q&A section now, and we'll get to them in about 10 minutes. So we have one question we'll get to in about 10 minutes time. So I'm going to ask Jimmy to respond to this next question. So Jimmy, we rank quite highly in the world, ranked 59th in the world for highly employable graduates, according to the 2020 QS rankings for graduate employability. Jimmy, you've been with us for a while. Why do you think New Zealand is a great place to study for someone looking to make a positive impact on the world through their career in science, medical and health sciences, and in particular for you, it's in health innovation?
Yes, thank you, Karen. And I think a little bit background of myself is I came to here like in 2011, so which is about 10 years ago. And it has been a fantastic experience, and I would like to say in three different scopes. First of all is the country level. It's the environment. The country has ethnic diversities, is welcome and friendly to all the migrants, people all over the world. And on the other hand, is about the university. While the universities is really acceptable to all the international students, and we provide some fantastic facilities to support our study through all the journey. And finally, it's up to all the staff of the university, especially like my supervisor, Professor Chris Bullen. We have been working together for over 5 years, and he has been really supportive to all my ideas. Sometimes some ideas might be naive, but he still showed the supportive and to tell me what is feasible to do, what is need more work to crafting it. So all the supportive environments that really boost the innovative thinkings, and that's where all the fantastic innovations and no more products will be made.
That's great. Thanks very much, Jimmy. And Thomas, if I could come to you with this question. As a supervisor and academic, why do you think New Zealand's a great place to study?
One reason is because New Zealand's a small country, so you've got the opportunity to make connections with all the people who and government and non-government organisations and around the country who have a real influence on New Zealand policy. And that's an opportunity you often wouldn't have in larger countries. I think that's something that's really distinctive about New Zealand.
And Nikki, would you like to add as a supervisor and researcher from your perspective?
Yeah, I mean, I think as a supervisor, you know, I've just spoken about the opportunities that early career researchers have had in our pandemic response, and that's, you know, really built on that national, I think, connectedness and links internationally. On a personal level as well, I did my PhD in Auckland quite a number of years ago, and then went overseas for further training. But it was really that grounding I got in Auckland, and then picking up experience from overseas and coming back and establishing my research here, that has enabled my group to really grow and flourish in this sort of nationally and internationally connected environment.
Thanks very much. And that kind of leads really nicely on to our next question, which I'm going to ask Thomas to respond to. So Thomas, how is your research helping to make a difference in communities outside New Zealand?
So one project I'm working with is with US statisticians designing population health research studies that provide reliable information at lower cost than current approaches. Which is very important in low resource settings. We've already used these for an obesity research study in the US and an HIV study in Brazil. And we're planning to use them in collaborations we've got with African medical researchers. So that's an example in making difference to, at least to research communities around the world.
Fantastic, thanks very much. Well, the next thing we have is the question from the audience. So the question from the audience, I'll just read aloud. We don't have it on the screen for you. Here it comes. Is there any specific roles that government should do for decreasing the number of COVID-19, the number of patient COVID-19, especially in developing countries? In particular, the strategies for handling that problem. So I'll ask Chris to respond to this in the first instance.
Sorry, no, I'm quite happy to have a go at addressing your question. Thanks very much. It's a really important and topical one, obviously. Just a bit of background. I'm part of a Lancet Commission on COVID-19 Public Health Strategies Task Force, which is a great example of the global collaboration that's currently going on in order to try and address the response to this huge challenge that we're all facing. And what's emerging from the comparative work that we're looking at between different countries where things have gone sometimes quite well and sometimes not very well at all so far in this part of the pandemic, is that it's not so much to do with whether they're high income or low and middle income countries or low income countries. It seems to be things that actually sometimes don't cost a lot of money, such as clear communication to the public from trusted leadership, consistent messages about what people can do simply to protect their health and protect those around them and their families, workplaces, etc. Hand washing, coughing into your elbow, physical distancing, mask wearing. You know, if you're sick, don't go to work. If you have work, all of these things, these don't cost a lot of money. Now, of course, there are costs and consequences from, you know, shutting down, lockdowns and all of that, which can have huge, and we're seeing the ramifications of these, and they will play out for a long time to come and have health consequences. And that's where the international community, I think, needs to step up for lower income countries to help support them in this time of crisis with the technical support for the healthcare and the lab-based community monitoring, contact tracing support and expertise, etc. But also with keeping the economy ticking over and trying to help avoid massive inequalities and poverty and so forth. So I think there are some things that can be done that seem to be low cost, but actually quite impactful. And this can happen even in the poorest of countries. And so, I think we're going to learn a lot of lessons from what's happening right now. And I guess hopefully in a couple of years' time, we'll be able to look back and be much better prepared for the next pandemic, which we hope won't come upon us too soon, but it's almost inevitable. So
thanks very much, Chris.
Communication are really important.
Yeah, fantastic. It's a really comprehensive answer, and I hope from the audience's perspective that has been helpful. The second question we have is, can we talk about the facilities that we have here at the university? And I think we'll come back to that at the end, if that's okay. So I'm going to go down to the next question, and I'm going to particularly ask Jude to consider this question, Jude. So I'm just letting you know now, as our Vice-Chancellor would say, Jude, I'm putting you on notice for the next question. In this pandemic situation, I'm concerned on the mental health development of people. What should lecturers, especially at the University of Auckland, do for maintaining good mental health?
Thanks for that question. It's a really, I think this is right on the button. It's absolutely a front of mind for us as lecturers. One of the things that we've all struggled with, and this is both the teaching staff at the university, it's people we are coming across in our community, but particularly our students, is how is it's that kind of keeping an eye on how everyone's coping. So the sort of things that we've been doing at Auckland University over this period of time, I mean, there's been kind of support put in place for students to be able to study at home or in offline away from the university. And to the extent that it's possible, that we've tried to make those resources available for our students. So trying to kind of enable people to have equitable, so the same access, so they're not disadvantaged by studying at home, even if they're sharing a household with 5 or 6 or more other people. So that's something we've really had to think about, there's some potential stresses obviously involved with trying to do things online, and some people manage far better than others. So we've been really thinking about ways we can preempt that, think ahead about how that might be played out for people's mental health and then respond to that. So it's something that our group of academics, the other teachers in our university have talked a lot about, and something that we discuss with our students. I mean, I'm certainly, and I'm sure others in this panel, check in with our students regularly, not just how they're progressing with their research or their assignments, but actually how they're managing and finding ways of supporting them in that process. But there is no simple answer to this one. It's just listening and responding and keeping that at front of mind, because that is our job. As much as many other things are our job as lecturers and academics here, is to consider student well-being, and mental well-being, particularly at this time, is absolutely critical. So I think that's a great question.
Thanks very much, Jude. And just to let people know that here at the University of Auckland, our students do have access to our counsellors through the health centre here at the University of Auckland, and our international students who are here on shore with insurance have access to private counselling services as well, up to $20,000 worth of counselling sessions through their insurance scheme. So if they are in need of support and assistance during the time that they're studying with us, there is reasonable facilities either here on campus or off-site through the private facilities, which are funded through the insurance scheme. Some of the faculties have also done things like providing study buddies or peer mentors, which has been quite successful, I think, in the Faculty of Arts, and something that I think the University of Auckland's looking to roll out in more broadly across 2021. So there is additional support here for our students, and obviously the academics are providing great support as well during this challenging time. Okay, so the next question I'm going to ask Thomas to respond to, because it's a science question, Thomas. Do you have any advice for high school students who wish to study science at the University of Auckland? Which subjects do they need to focus on, and any soft skills they need to prepare? So Thomas, over to you, and then if we need to, we'll ask Nikki to respond as well.
Yeah, so there are some, it depends on which area of science. So your people will need to have some background in specific science courses. So most people will want some maths background. And if you're interested, for example, in going and studying immunology with Nikki, you probably want to have some biology background. But the subjects will depend on what you're studying. The soft skills, it's important because there are some important things that aren't sort of prerequisites, but are valuable if you're going to be successful. So writing is a very important skill. Even if your native language isn't English, being able to write well in your native language is still helpful for being able to write academic English. Working with other people. So it can be very difficult when you're working with a group of other people to actually do it productively. So one person doesn't end up doing all the work, or even worse, everybody does all the work and you just duplicate effort. So working with other people's another important skill. And recognizing that these things are going to happen. You're going to have to work with other people, and they may not be good people to work with. That sometimes happens. You're going to have to give presentations where you talk to groups of people, and that may be scary, but it's something that happens. So we try to provide these soft skills, but part of it is recognizing that you will have to learn them.
Fantastic. And Nikki, do you have an additional sentence or so to go with that?
Yeah, so I mean, around the soft skills, definitely in line with Thomas's thinking there. So the communication skills are really important. So, oral, written communication, being able to get up and talk to people, have conversations, especially if you're working in sort of cross-disciplinary research. Sometimes you're having conversations with people that have expertise that is very different from you. So you need to be able to sometimes articulate quite complex things really clearly and simply to get that research or work going.
Yeah, fantastic. Thanks. And there's lots of great support here at the University of Auckland around those soft skills. So creative writing, critical thinking courses, academic English, all of those things. And there's lots and lots of support through the library and learning services here at Auckland that can help. So we do have good support services here for students once you're with us. And if you're looking at coming into the Faculty of Science to do biomedical science or health science as a first year student thinking about medicine, I always suggest to students that they keep their chemistry going at high school, because that's one thing that's quite challenging to pick up if you don't have a background in chemistry. Bio, we've got experts and we can teach you the bio, but keep your chemistry going if you need to. The next question, I think, is equal access into health resources within the communities is important, and how innovation can contribute to these areas. Is there any specific projects that the New Zealand Government or University of Auckland are working on in regards to this area? So Jude, I'm not sure if you can read this question, but I'm going to put it back to you and ask if you can respond to this.
Yeah, look, I think it's, I can see the question, and I think it's a really important question, thinking about, again, one of the focus of the work that we do is around trying to enable equitable access. So making sure that people who need services and resources have able to get hold of them, essentially. So what we're learning about this is absolutely that not everyone has the same access to resources, particularly when it comes to digital resources. So a lot of the assumptions we had in the past about the digital divide or everyone being on their mobile phones isn't actually the case when you dig a bit deeper. So one of the things that we're trying to figure out is try to understand about health and digital literacy, and particularly But thinking about how innovation can improve access to health resources, I think some of the things we've discovered in our work is sometimes the most simple innovations are the most effective and most equitable. So if we think about, for example, and Chris mentioned it earlier about support for quitting smoking, I mean, there is a number of great resources that you can access for quitting tobacco use. But one of the things that we found to be really helpful, and colleagues certainly in the National Institute for Health Innovation pioneered, was sending people text messages to support them to quit smoking has been really effective. So that's one of the ways, but we are using health innovation in a bunch of ways in terms of just being able to use data that we collect more efficiently. So we have to make greater use of the data we're getting to make sure we are responding to populations' health needs in a more timely and appropriate way. So I think innovation and health is just burgeoning at the moment, and we're only seeing the beginnings of what that potential is, with the focus on improving health outcomes for people, letting people get access to those tools and potential. It's heading in the right direction.
Fantastic. And the Ministry of Foreign Affairs and Trade here in New Zealand are providing some funding for projects and for research for students to come to New Zealand or potentially commence offshore if they can't get here for 2021. So there is some support through the New Zealand government scholarship scheme called New Zealand Scholarship. So check that out if you're interested in the development scholarships through our website. Okay, the next question we have, and I'm just mindful of the time now, we've only got a couple of minutes to go. So the next questions are both kind of related. They're about University of Auckland. So the first one is, can we talk about information on what facilities we have at the University of Auckland in health and science? And the second one is, because of the current pandemic, there must be some learning activities that cannot be done. How are we handling this? What things are being done to keep learning activities effective, particularly in health and science? And so I wonder, Chris, if you're aware of the work that's being done at FMHS, the Faculty of Medical and Health Sciences, around online delivery for students who can't get into campus. Of course, our students are here on campus at the moment, but we do have some students who are studying offshore and are online.
Yes. So as you say, Karen, we're very fortunate to be back meeting together again on campus. But for a couple of months, we've had online delivery. And in fact, I was really proud of our university's ability to pivot, using that word, from our normal delivery of our teaching, and within the space of a week to move to fully online in order to be able to support our students. And that was just a fantastic effort. And I know it's been greatly appreciated by the students. It's not perfect, and it's been difficult and challenging, but we were able to do that because we had the infrastructure and the technical know-how in place, and the willingness and encouraged to try that. And the student body were brought on board and supported that. And that's actually been really a useful experience in some ways, although it's been hard for both students and staff. We've learned some new things through that experience, which I think will maybe strengthen some of the ways in which we deliver some of our courses going forward. But of course, the hands-on clinical lab-based programs, that's been much harder, where those kind of practical hands-on skills and so forth haven't been easily able to be substituted in the sort of digital way, though there's been some really creative things done to make the best of it for students, and I know that's been hugely appreciated. And perhaps Nikki, from a biomedical perspective, could speak to some of that side of things. But from my side of it, we've really worked hard to deliver first-rate programs and support our students by going fully digital, and it's been very successful.
Nikki, would you like just a quick comment about what's happening with teaching online in your space?
Yeah, I mean, obviously a component of studying biomedical science is the practical laboratory aspects, and we are very fortunate at the moment that our teaching labs have been open, and so it's been great to see the students back in the labs with pipettes and doing all the things that they should be doing in the lab. When the lockdowns happened and we weren't able to get students into the lab, we did instead film teaching labs, and then we're able to sort of chunk those up into small practical exercises, and so whilst it's definitely not making up for students getting that practical experience in the lab, we tried to make those sessions as interactive with small quizzes, and really it was real life filming in the lab. We were doing these things, and yeah, there's I think lots of opportunities to learn from that, and use some of those digital tools going forward as well.
Fantastic. Thanks very much, Nikki. Here at the International Office, we are working with our international students who have offers of place or are interested in coming to us here at the University of Auckland to start online and come on campus when they're able to do so. And there's a glorious Maori expression, and I'm hoping I'm going to pronounce this correctly, but it's he waka e noa, which is we're all in this together. And so we're here to support our students and do everything we can to assist you to commence online if you're not able to be with us. And in fact, I'm working very, very closely with the head of the medical program to allow our own overseas students to start year 2 medicine offshore online, which is quite an extraordinary thing. So we're working really, really hard to develop as much content as we possibly can. And it's not just about delivering a recorded lecture. It's there's a lot more to what we deliver to our online students. We do have a list of courses that are not available to be delivered online. As Nikki says, some things are really, really clinically focused and you need the patients in front of you. Some things like dance need a studio space and not able to be delivered. So we do have a list of courses that are not available online on our website, and we'll be in touch with our existing students and offer holders to let them know exactly what they can expect for semester 1 and beyond for 2021. That leads us really nicely to a little wrap up. We greatly appreciate the questions we've received from you. We think we've answered them all. You did ask about facilities on campus at usual times, and we're going to show you some information with some links on the next slide. This webinar is being recorded and you'll be able to go back to it at any time. It will be on our YouTube site and there'll be a link to the website from that. We've got some fantastic images on our University of Auckland website around the facilities at both FMHS and the medical school, the Faculty of Medical and Health Sciences and the Science Faculty, where you'll be able to have a little look at the facilities and the types of stuff we have on site. And so just like to say thank you very much to the audience for joining us this afternoon for this really interesting conversation about what our faculties of medical and health sciences and science are doing, both around the SDGs and around our global impact in general. There's some great links here. Have a look at our Twitter feed or Facebook if you use it, or LinkedIn. We've got a fantastic Sustainability at Auckland webpage, which you might be interested in, and there's a QR code there if you're interested. I'd just like to wrap up by saying a huge thank you to the panelists, to Jin Song Chen, Jimmy, our PhD student and alumni of both a Bachelor of Health Science and the Master of Public Health, to Professor Chris Bullen, to Professor Thomas Lumley, to Associate Professor Judith McCall, and to Dr. Nikki for joining us this afternoon. Nikki, it's fantastic to have you with us from Christchurch. We appreciate you zooming in. We look forward to seeing you again. Please keep in touch, and kia ora, kia kaha. Farewell.